Hello friends, myself Reshma here. Today I am going to discuss about human diseases caused by bacteria. The first disease is tetanus. Tetanus is a serious life-threatening disease caused by an exotoxin produced by the organism called Clostridium tetani. It is an obligatory anaerobic endospore producing rod. From this we can understand that it is a rod shaped and it is a bacteria obligatory in nature. Next is how it is transmitted. It is transmitted through soil contaminated wound and typically a deep puncture. In the wound, anoxic conditions develop around the dead tissue and allow germination of endospores, growth of organism, and production of protein exotoxin, the tetanus toxin. Symptoms may take 4 days to several weeks depending upon the number of endospore inoculated at the time of injury. We already said about a tetanus toxin. It is also called tetanospasmin, which is an endopeptidase which selectively cleaves the synaptic vesicle membrane of protein synaptobrevin, which prevent the exocytosis and release of inhibitory neurotransmitters. Which leads the directly affect the release of inhibitory signaling molecules in the nervous system. For example, gamma aminobutyric acid and glycine. The inhibitory molecules is the reason to control the relaxation phase of muscle contraction, which results uncontrolled stimulation of skeletal muscles. In the absence of inhibitory signaling molecules, results rigid paralysis of the voluntary muscles, often called lockjaw. This disease is called lockjaw because it first observed in the muscles of jaw and face. The characteristics of this lockjaw is inability to open mouth because of spasm of masseter muscle produce characteristic expression. That expression is called a rhesus sardonicus. Preceding actual lockjaw tetanus symptoms also include mild spasms of facial muscles and muscles of neck and upper back. Later paralysis extend to torso and lower body. A second toxin is called tetanolysin, which is a adelysin which aids tissue destruction. Uh, Tetanus is fatal due to the respiratory failure, which results from the spasms of diaphragm and intercostal respiratory muscles. The mortality rate of tetanus is relatively high, occur about 10% of all reported cases. Up to 50% of cases, treatment is delayed until generalized full body tetanus has set in. When we come to the diagnosis, it is based on the exposure, clinical symptoms, and rarely identification of the toxin in the blood or tissues of the patients. Control include natural reservoir of Clostridium tetani in soil, and thus control measures focus disease prevention rather than pathogen removal. Tetanus toxoid vaccine is highly effective. When we come to the treatment, a second line of protection to administer appropriate medical care to serious cuts, lacerations, and punctures. If the last vaccination is 10 years ago, revaccination is recommended. But in the case of vaccinations, there is a chance of hypersensitivity reactions. If a wound is deeply contaminated by soil, treatment might also include administration of tetanus antitoxin preparation. Acute symptomatic tetanus is treated with antibiotics, penicillins to stop growth and production, and antitoxin is injected intramuscularly to prevent binding of newly released toxin to cells. Supportive therapies such as sedation, administration of muscle relaxants, and mechanical respiration may be necessary to control effect of paralysis. Next disease is cholera. Cholera is caused by ingestion of contaminated water containing cells of Vibrio cholerae, a gram-negative and motile curved species of proteobacteria. Cholera can also be contracted from contaminated food, especially improperly cooked shellfish. The ingestion of large number of Vibrio cholerae cell is required to cause disease. The ingested cells attach to epithelial cells in the small intestine where they grow and release cholera toxin, a potent enterotoxin. Cholera enterotoxin causes severe diarrhea that can result in dehydration and death unless the patient is given fluid and light therapy. The enterotoxin causes fluid losses up to 20 liters, 20 kg of 44 lb per person day, causing severe dehydration. The control of cholera disease include reliable source of safe drinking water are the keys to preventing cholera. Vibrio cholerae is eliminated from wastewater during proper sewage treatment and drinking water purification for individuals traveling in cholera endemic areas. Attention to personal hygiene and avoidance of untreated water or ice, raw food, and raw or undercooked fish or shellfish that can feed on phytoplankton contaminated with the Vibrio cholerae. The treatment and diagnosis include treatment facilitated in large outbreaks of cholera. Each cholera patient is placed on a cholera cot, which is a conventional folding cot containing an opening into which fecus can be voided. The fecus of a cholera patient are also liquid than solid, and confirmation of the disease is straightforward since the pathogen is easily cultured on selective agar media. Cholera treatment is simple and effective, and oral liquid color rehydration solution and electrolyte replacement therapy is the most effective means of treatment. The composition of rehydration solution is glucose, sodium chloride, sodium bicarbonate, KCl. If it is administered quickly during an outbreak, cholera mortality can be reduced. Rehydration allows patients the time necessary to mount immune response. Antibiotics shorten the course of cholera infection. Antibiotics are little health benefit without simultaneous fluid and electrolyte replacement therapy. Yes, we are going to discuss about typhoid. Typhoid's causative organism is Salmonella enterica serover typhi, which is a gram-negative peritricosally flagellated bacterium, which is transmitted through in fecus or contaminated water, and thus typhoid is primarily restricted to areas where sewage treatment and general sanitation are either absent or ineffective. Typhoid fever progresses in several stages. Cells of pathogen ingested in contaminated water reach the small intestine where they grow and enter the lymphatic system and the bloodstream. From there, pathogen can travel into different organs. In 1 to 2 weeks later, the first symptoms of typhoid appear. These include mild fever, headache, general malaise. During this period, liver, spleen of the typhoid patient become heavily infected. About a week later, the fever become more intense up to 40 degrees Celsius and the patient typically become delirious. Diarrhea can occur in this stage and abdominal pain can observed. Complications like intestinal bleeding and perforation of the small intestine can occur. Then later it releases large number of bacterial cells to the abdomen, leading to the condition called sepsis. It is otherwise called systemic infection and inflammation and possibility to septic shock. Both are potentially fatal condition, about 40% fatal. After a week passing this crisis stage, symptoms begin to wane and recovery occurs. In some patients, gallbladder become infected with the pathogen. If these individuals also have gallstones, then the colonized with the typhi cells serve as long-term reservoir of pathogen from which continuously shed into fecus urine, and they act as carriers. Typhoid Mary is an example for this. The treatment of this disease is by ceftriaxone or ciprofloxacin has reduced mortality rate to less than 1%. Recovery from typhoid confers permanent immunity. Its control include drinking water was routinely filtered and chlorinated. However, breakdown of water treatment methods, contamination of water during floods, earthquake and other disasters, or contamination of water supply pipes with leaking sewer lines can propagate epidemics of typhoid fever even in developed countries. Next, we are going to discuss about leprosy, which is caused by the organism called Mycobacterium leprae, a relative of Mycobacterium tuberculosis, causes the disease of leprosy, more formerly known as Hansen's disease. Its transmission is through leprosy is transmitted by direct contact as well as by an airborne route. Uh, by prolonged exposure of the infected individual's nasal secretions or infectious materials for family contacts. More serious form of leprosy is lepromatous leprosy, which is characterized by folded bulb-like lesions on the body, especially on the cooler parts of the body such as face and extremities. Lesions due to the growth of Mycobacterium leprae cells in skin and contain large number of mycobacterial cells. The incubation period is 3 to 5 years. Disease progress slowly. Bacterium invades peripheral nerve, skin cells and become obligatory intracellular parasite. Most found in Schwann cells of peripheral nerve axons in mononuclear phagocytes. Early symptoms of leprosy include slightly pigmented skin, eruption several centimeters in diameter. These solitary lesions heal spontaneously due to the mediated immune response. Leprosy occurs in two distinct forms, tuberculoid or lepromatous leprosy. Tuberculoid leprosy is mild, non-progressive with a delayed hypersensitivity reaction to antigen on surface of Mycobacterium leprae, which is characterized by damaged nerves and regions of skin that loses sensation and surrounded by a border of nodules. Lepromatous leprosy is the severe condition in the case of leprosy, which is occurs in person who do not form hypersensitivity. Large numbers of Mycobacterium leprae develop in skin cell. It kills skin tissue, leads progressive loss of facial features, fingers, toes, and other structures. This leads to disfiguring nodules to form all over the body. Nerves also infected, but usually less damage than occur in tuberculosis leprosy. The diagnosis is done by, since it is not cultured in vitro, diagnosis is supported by demonstration of the bacterium in biopsy specimens using direct fluorescent antibody staining. Serodiagnosis methods such as fluorescent absorption antibody test, DNA amplification, and ELISA have developing. Treatment is long-term with the sulfone drug diacetyldapsone and rifampin with or without clofazimine. Alternative drugs are ethionamide or proteonamide. Use of mycobacterium vaccine in conjunction with the drugs shorten the duration of drug therapy and speedy recovery. The nine-batted armadillo is an animal reservoir for leprosy in Bacillus in US, but play no transmission to humans. Next disease is pneumonia. Its causative agent is Streptococcus pneumoniae, a species that can cause invasive lung infections, typically as secondary infection to other respiratory disorders. Pathogenesis include encapsulated strains of Streptococcus pneumoniae are particularly pathogenic because they are very invasive. Cells invade to the lower respiratory tract where the capsule enables the cells to resist phagocytosis, generate a strong host inflammatory response. Reduced lung function, called pneumonia, results from the accumulation of recruited phagocytic cells and a fluid, which is a rust-colored fluid. Cells of Streptococcus pneumoniae can then spread from focus of infection as a bacteremia, sometimes infecting the bones, middle ear, and head valve. heart valves. Streptococcus pneumonia infection is often cause death in elderly persons who die from respiratory failure. The treatment include effective vaccines are available for preventing infection by the most common strains of Streptococcus pneumoniae. A vaccine for adults consists of mixtures of 23 capsular polysaccharide from the most prevalent pathogenic strains. The vaccine is recommended for those over age 16 is healthcare providers, individuals with a compromised immunity and any other high risk population is vaccination is recommended. Streptococcus pneumoniae infections typically respond quickly to penicillin therapy, but up to 30% of pathogenic isolates now exhibit resistance to this drug. Resistance to antibiotic erythromycin cefotaxime is also found in some strains, but thus far all strains have been found sensitive to vancomycin, an antibiotic held in reserve treating pneumonia and several other bacterial diseases where antibiotic resistance is widespread. The next we are going to discuss about tuberculosis, which causative agent is Mycobacterium tuberculosis, transmitted by a respiratory route. Uh, Tuberculosis can take several forms. TB can be primarily infection or post-primary infection, which means reinfection. Primary infection typically results from the inhalation of the droplets containing Mycobacterium tuberculosis, after which the bacteria settle in the lungs and grow. The host mounts an immune response to Mycobacterium tuberculosis, results in the formation of aggregates of activated macrophages called tubercles. Bacteria are found in sputum of individuals with active disease, and areas of destroyed tissue can seen in chest X-rays. Mycobacterium survive and grow within macrophages in the tubercles, forming granulomas. A diagnostic sorry a diagnostic skin test called a tuberculin test detect the hypersensitivity, and many health adults are tuberculin positive as a result of previous or current inapparent infections. The treatment of tuberculosis is antimicrobial therapy. TB has been a major means of controlling the disease. Streptomycin was the first effective anti-tuberculosis antibiotic. Real, real revolution in tuberculosis treatment came with the discovery of isonicotinic acid hydrazide called isoniazid INH. This drug is highly effective and readily absorbed when given orally. Isoniazid is a growth factor analogous of the structurally related molecule nicotinamide in mycobacteria. The drug inhibits mycolic acid synthesis, and this comprises cell wall integrity. Following treatment with isoniazid, mycobacteria lose their acid-fast properties in keeping with the role of mycolic acid in this staining property. Here are the references.